On Friday, October 29th, the Food and Drug Administration authorized the vaccination for emergency use in children ages 5 to 11. A few days after that, on Tuesday, November 2nd, the Center for Disease Control and Prevention formally endorsed the Pfizer BioNTech COVID-19 vaccine for children 5 to 11, clearing the way for immediate vaccination of the youngest age group yet in the United States. About 28 million U.S. children will be eligible for the vaccine, including 37,000 in Sonoma County. The Pfizer vaccine is the only vaccine so far to receive emergency use authorization for those ages 5 to 11. Children will receive 1/3 of the dose authorized for those 12 and older. To be fully vaccinated, kids will need 2 doses, that is 2 injections, 3 weeks apart. The vaccine is safe, it's free, and it has similar or fewer side effects that teens experience, such as arm pain, fever, or pain. The vaccine will be delivered by smaller needles and stored in smaller vials to avoid the mix-up with adult doses. After their second dose, children ages 5 to 11 develop antibodies levels as strong as teens and young adults who receive the regular strength injections. Now, why is it important to vaccinate our kids? Let's talk about the impact that COVID has had in children along the pandemic. Although children are less likely than adults to suffer severe illness from COVID, nearly 2 million U.S. children between the ages of 5 and 11 have tested positive for COVID since the pandemic began. According to a CDC analysis, the number of children admitted to the hospital increased nearly 500% over the summer months, due primarily to the surge from the Delta variant. The CDC said that children ages 5 to 11 account for 10.6% of all cases, but only 8.7% of the population. In the United States, more than 2,000 U.S. schools were forced to close between early August and October due to outbreaks that affected more than 1 million students. Here in our county, since in-person classes resumed, as of November 16th, there has been more than 800 cases affecting mostly students of elementary schools and frequently disrupting the continuity of classes. Some children who are infected may go on to develop long COVID, remaining ill for months after the initial infection is gone, or may develop multisystem inflammatory syndrome, which has affected at least 5,200 children in the United States. There is clear evidence that the vaccine provides strong protection for those of all age groups, including children as young as 5. According to the American Academy of Pediatrics, more than 8,300 children in the United States have been hospitalized for COVID, and more than 900 children aged 18 and younger have died as of November 15, 2021. It will also help protect other members of your family, friends, and people at school who may be more susceptible to severe illness. Infected children can spread the virus to others even if they do not have symptoms. Some people have asked if they will have to pay for vaccines or show proof of citizenship. The answer is no. Vaccines are provided at no cost to anyone regardless to immigration status. Social security numbers or U.S. citizenship are not required. You may be asking, how and where can I schedule an appointment for my kids? Parents are encouraged to reach out to their pediatrician to ask all questions or doubts they may have about the vaccines and make an appointment for their kids. Parents can also make an appointment at Myturn.ca.gov to find a vaccine for their children in a local pharmacy. Pediatric vaccines also will be available at clinics planned for school sites. In partnership with the Sonoma County Office of Education, vaccination clinics will be set up at designated schools to serve people who do not have convenient or affordable access to healthcare providers. A list of scheduled clinics at schools is available on the Sonoma County Office of Education website, scoe.org. Doses for those 12 and older will also be available at those clinics. The county's pediatric vaccine campaign is being planned with a focus on equity. The target sites for school-based clinics are in areas with high case rates, areas with high numbers of learners of English as a second language, and areas with lower vaccination rates. Those doses are intended for those school populations. No ID or birth certificates will be required. In Sonoma County, consent forms will be required if the child is not with a parent or guardian. Consent forms are in English and in Spanish. To find more information about school clinics, go to scoe.org. You can also find more information at socoemergency.org or by calling 707-565-4667. Feel free to reach out to your pediatrician or healthcare provider to ask any questions that you may have regarding the COVID-19 vaccine. Our goal is to reduce the risk to our children and have you feeling confident about vaccinating your kids.